Contraception, also known as birth control, plays a crucial role in family planning and reproductive health. It empowers individuals to make informed decisions about when and if they want to have children. With various options available, contraception offers flexibility to suit different lifestyles and preferences. One commonly used method is hormonal contraception, such as birth control pills, patches, and injections. These methods release hormones to prevent ovulation and thicken cervical mucus, hindering sperm from reaching the egg. Another effective option is intrauterine devices, IUDs, inserted into the uterus to prevent fertilization and implantation. For those seeking a non-hormonal approach, barrier methods like condoms and diaphragms offer protection by preventing sperm from reaching the egg. Emergency contraception, often called the morning after pill, is used after unprotected sex to prevent pregnancy. It offers a backup option in case regular contraception fails. Choosing the right contraception method depends on factors like health status, lifestyle, and family planning goals. Consulting with a healthcare professional can help individuals make informed decisions and select the most suitable option. With a plethora of choices available, contraception empowers individuals to take control of their reproductive health and lead fulfilling lives. Let's talk about the diverse uses of contraception. Contraception serves as a powerful tool, offering individuals the ability to plan their families and take control of their reproductive choices. By preventing unintended pregnancies, it allows people to pursue education, career goals, and maintain financial stability. One of the primary uses of contraception is to prevent pregnancy. Hormonal methods, such as pills or patches, and non-hormonal options like condoms, are highly effective at reducing the risk of conception when used correctly. They provide individuals the freedom to enjoy intimacy without the constant worry of unwanted pregnancy. Beyond family planning, some contraception methods offer additional health benefits. Hormonal contraceptives, for instance, can regulate menstrual cycles, reduce the intensity of cramps, and improve acne in some cases. Moreover, contraception can be a helpful tool for managing certain medical conditions. For instance, hormonal methods may alleviate symptoms of polycystic ovary syndrome, PCOS, and endometriosis. Contraception isn't solely for women. Male contraceptives such as condoms and vasectomy offer men the opportunity to take an active role in family planning. Overall, contraception comes in a diverse array of methods, enabling individuals to find one that aligns with their preferences, health needs, and lifestyle. From preventing pregnancies to managing health conditions, contraception empowers people to make choices that positively impact their lives, fostering a society where reproductive health is a shared responsibility.